Your Dog's Friend is a nonprofit 501c3 whose mission is to help keep dogs out of shelters by educating and supporting their humans. We promote positive method of training and behavior modification through stress-free methods. As part of that mission, we offer free webinars like the one you're about to watch. Subjects range from dog behavior, stress-free training, and other tools to help you understand your relationship with your dog. If you like the webinar, be sure to give us a thumbs up. Click the notification bell and subscribe to our channel. By subscribing, you'll be notified when future videos are posted. Now enjoy the webinar.
Hello, everyone. Today's webinar on PTSD in dogs is being presented by someone who knows firsthand about this topic, Dr. Amy Pike. As a captain in the Army Veterinary Corps, she saw military working dogs returning from deployment, and as a veterinary behaviorist, she has witnessed the effects of PTSD in our pet dogs. Dr. Pike is the co-owner of Animal Behavior Wellness Center with dog trainers, a boarded behavior nurse, and veterinary behavior residents part of the team. The center has 2 locations, Fairfax and Richmond, both in Virginia. Dr. Pike has written articles for veterinary journals, is a member of the Fear-Free Advisory Committee, and presents at veterinary conferences across the country. In her Fairfax Center, she sees pets with various behavior disorders that range from mild fears to extreme aggression, compulsive disorders, and panic disorders. Dr. Pike is also working to expand prevention services with her support staff by providing socialization classes and patient handling workshops for other veterinary professionals. Please put your questions in chat. We will get to them at the end. Hopefully we'll get to all of them or almost all. And I want to remind you that your donations help support these free webinars. So if you are inclined to donate, you can go to our homepage at yourdogsfriend.org. And in the upper right-hand corner, you'll see a logo for donations. We appreciate whatever you can do. I know that we will all learn a lot today, and I am delighted to welcome back one of my favorite speakers. Now over to you, Dr. Pike.
Thanks, Deborah. I appreciate it. Always happy to be here and speak with YDF fans across the world. So thank you for what Your Dog's Friend does and putting these webinars out to the masses so that we can get information out to all of our pet-loving people out there. So as Deborah said, I'm going to be talking about PTSD in pets, and my background is as a former military veterinarian. This is me with Nanny, the Navy goat that used to get put on the Army general's lawn every year when Army played Navy for their big football games. So we would have to go as the veterinarians go out and rescue Nanny and bring her back to our kennels where she basically hung out for the rest of the year. So she was a pretty cool, fun little friend that we had. So when I was active duty, it was in 2003 after I graduated from veterinary school until 2006. And that was our first wave of deployments to Iraq and Afghanistan. And several of my military working dogs and their handlers went overseas and were a part of those conflicts. And a couple of my dogs were involved in a roadside bomb incident. After they returned with their handlers from Iraq, I think one was Iraq, one was Afghanistan, and they demonstrated signs of what we now know is PTSD in dogs. And they would spin in their kennels, whereas previously they did not do that. Every day at 5 o'clock, if you've never lived on a military base or worked on one, every day at 5 o'clock, a cannon goes off and they play the song Retreat, which means it's time to take the flags down. And our working dog kennels were very near the cannon. And prior to the deployment, The dogs were fine with that cannon. They heard it every single day at 5 o'clock. And after deployment, whenever they would hear that go off, they would really, really get very anxious. And so, unfortunately, both of them had to be treated. One was able to return to service, and one was eventually adopted out by her handler. And so, unfortunately, we, despite our best efforts, weren't able to make her be able to return to service. So this is a really important topic amongst our military and our police animals that we use, but also amongst our pets as well. So let's kind of talk about what is PTSD. The definition does come from the human mental health side, and the definition is a mental health condition that's triggered by a terrifying event, either experiencing it or witnessing it. And symptoms in humans may include flashbacks, nightmares, severe anxiety, as well as uncontrollable thoughts about the event. Now, I underline flashbacks, nightmares, and uncontrollable thoughts because if you think about it, we can't really tell if our animals are having those, right? So do dogs get PTSD, and how do we know that? Well, there was one study in Japan. There was an earthquake called the Fukushima earthquake, and dogs that were ended up in a shelter after the earthquake because of the earthquake had 5 to 10-fold urine cortisol levels of those dogs who were also abandoned, but not because of the earthquake. So cortisol is our stress hormone. And when we are stressed, we emit an excess level of cortisol. We have normal levels of cortisol that circulate and do normal bodily functions. But when we are stressed, we get that peak of cortisol, and it's designed to allow us to fight or flee, rather. So in these dogs, what they showed was that the dogs that were had experienced the earthquake and were homeless because of that had a high level of cortisol compared to those dogs that were just abandoned or ended up in the shelter for other reasons. So it wasn't just the fact that these dogs were in the shelter, which could be a stressful experience. It really was because they had been involved in that earthquake. There's also a study, it's now an older study, it's 10 years old now, but it came out kind of right during the middle of my residency, and it was by Dr. Walt Burkhart, who is a veterinary behaviorist colleague of mine, and who used to work for the military at the Working Dog Center. And what they were looking at is a preliminary evaluation of a case series of our military working dogs that were affected with PTSD. And the behaviors that these dogs displayed after a stressful event, they were hypervigilant, they had high avoidance behaviors, so they're trying to avoid certain tasks or certain places or even certain people, and they failed to perform critical tasks. Now, these critical tasks are their job tasks. So our military working dogs are oftentimes dual trained, is what we call it. So they are going to be either a drug detection dog or a bomb detection dog, but then both of those are also typically patrol dogs, meaning that they are trained to attack as needed and on cue, what if the military police need that. And so these dogs were literally failing their mission to either respond to the cue to attack or to alert upon drugs or bombs, which obviously is very mission critical. Now, in this series of dogs affected with PTSD, with treatment, 50% of those could return to service. Now, the other 50% that could not return to service were adoptable, so that's good. However, again, the stakes are high with these dogs. They, go through a lot of training, significant amount of money goes into that training, and so to lose 50% of your population because of PTSD associated with a trauma event is really, really significant. And so these data are more recent than that 2013, but approximately 5% of all military working dogs are affected by chronic PTSD. And this is the single greatest cause for loss of deployability in our military working dogs. And if you are familiar at all with our military working dogs, they're most often Malinois, German Shepherds, Belgian or Dutch Shepherds. So these are large breed dogs. And so as large breed dogs, they are prone to things like osteoarthritis, potentially certain cancers, and yet none of those things provides a greater loss of deployability than PTSD does. The thing about military working dogs and police dogs in general is that they are a stable temperament, or as stable as we can possibly have them, because they are purpose-bred for behavioral traits. These dogs are not necessarily going to be winning show dog competitions. They're not the most handsome German Shepherd or Belgian Malinois out there. They don't even care if they're, in certain size regulations or anything like that. They are literally bred for their behavior, and they're purpose bred. They are either bought from kennels that are vetted basically for providing animals to the military or police. And they legitimately, their only purpose in life is to have this behavior. And so they're very, very stable. So recovery from stressful events. Oh, and the other thing I was going to say too is not only that, but they go through a puppy raising program, in which if they do not sort of pass muster, they're going to be washed out. And so they're not going to keep any dog that isn't as stable as we possibly can have. So again, recovery from stressful events is likely much more successful than your average pet who is not bred for purpose behavior. So how does this apply to our pet population? So one thing to understand is how behavior develops. So there is learning that takes place. We have genetics, and then we have experiences that the animals have throughout the course of their life. So there's a couple studies out there looking at sort of what the genetics are with various fears, phobias, et cetera. This one in particular was a very old study looking at thunderstorm phobic dogs. And what they found was that herding dogs and herding crossbreed dogs accounted for the majority of dogs in their study. Myself, I did my residency research project on thunderstorm phobias and the use of a nutraceutical, which we'll talk about towards the end of this lecture, but the use of a nutraceutical for dogs that were thunderstorm phobic. And what we found in our study, again, different population, was that we were more likely to have gun dogs that had these noise phobias. And we surmised that it was because where these pets were obtained from were either local kennels that were breeding for hunting dogs, and if the dog failed a gun test, meaning they were very nervous when the gun went off, those dogs were sold as pet homes. Or like in our area, we see a lot of it here in the DC area, where dogs that are, fail their hunting test simply just run away from the kennel. Like if they're out in the woods, they hear the gun, they're going to just run away. Rescue organizations pick those dogs up as strays, or they end up in a shelter because someone has found them. And so therefore they're already prone to noise phobias, right? So there's that genetic component there. There's also certain periods of time in an animal's life that are more sensitive. So the socialization period is basically a window of opportunity in any species, but I particular obviously pointing out dogs and cats here, that is more sensitive and where the animal is more open to experiencing new people, new places, new sounds, sights, smells, etc. And for cats, it's a very narrow window, anywhere from about 3 to 9 weeks of age. And for dogs, we have a little bit longer, from 3 to 12 weeks of age. And after that window of opportunity closes, if an animal hasn't been exposed to something during that time frame, they are much more likely to find that thing scary later on. So I tell this story a lot, and if you've ever heard me lecture before, you may have heard it, but I was teaching puppy socialization classes when I was practicing in Kentucky, and we had a group of students and their pets on their first day, and we were talking about what socialization is and why it's so important. And I said, I can't tell you how many times I have heard clients come in and say, well, my dog must have been abused by a man wearing a hat and, wielding a broom, because he's scared of all men people wearing hats, and anytime I pick up something that looks like a broom, they're terrified, right? And this cute little, a little older Southern woman raises her hand, and she's got her little floofy Maltese in her arms, and she says, "Well, honey, when have you ever seen a man pick up a broom?" And after we all got done laughing hysterically because it was so adorable that she said that, it just really brought that point home to everybody. It's like there are not a million men out there running around, in hats, wielding brooms, abusing dogs, right? It's much more likely that the animal never were exposed to certain genders, certain colors of people, people wearing different things like hats, carrying an umbrella, sunglasses, or doing things like vacuuming, sweeping, etc. And so if they are not exposed to that, we may assume that, oh, they must have been traumatized by something that looked like that object or that person, but actually it might actually be a lack of socialization to that during that early period of time. So why is socialization important? So I consider it vaccinating against behavior problems. So when a puppy or a kitten is young, they get a series of vaccines from your veterinarian that are trying to prevent some of the most common diseases. And socialization is really like trying to prevent some of the most common behavioral problems. So fears, phobias, anxieties. We're hoping to prevent those future problems. And in my opinion, a lack of exposure is actually probably worse than having a trauma experience. I have definitely seen more severe issues with dogs that lacked socialization versus ones that actually had a true trauma event. And improper or deficient socialization can absolutely cause lifelong deficits. So again, they could have a trauma event, and obviously that's what we're talking about is PTSD. In our storm study, one of the most common things that owners reported was that they did not develop issues with thunderstorms until they had experienced either a storm and they were caught outside, or many of them had actually been to a 4th of July fireworks display, like they'd taken them to the local park or to a friend's house. And the moment that they heard fireworks, all of a sudden, then they were terrified of storms as well. So I'm going to talk to you about Luna, and Luna is going to be kind of our patient that we're going to follow through the rest of our talk here. She was a 9-month-old female intact Bernese Mountain Dog that presented to me at 4 months of age, and she had fallen headfirst out of a moving car. Unfortunately, her owners, had the windows down, and they were driving their car, and thankfully not fast. They weren't on the freeway or anything like that, but it wasn't insignificant. And she did jump out of the window. The owners are not sure why she did that, if she saw something, but she was taken immediately to an emergency room. She was also had an MRI and was evaluated by a neurologist and had no obvious neurologic consequences, which is wonderful. But immediately the owners noticed a significant change in her personality. She had intense anxiety, fear of new people, places, and objects. She would get so terrified if she saw like a plastic bag rolling in the wind that she refused to go outside for days on end. Now, Luna had been the shy, reserved puppy of the litter and had specifically been given to this family in light of that because they were a young couple. They lived in an apartment condo situation in DC. And so the breeder felt like, all right, this puppy's probably going to be the best for you because she's the quietest, but really what that meant was that she was the most shy. So was Luna more predisposed to developing significant issues after a traumatic event? Possibly, because she was already showing some issues with being a timid dog. Learning and reinforcement and punishment goes on throughout the course of our lifetime. And when we are teaching our dogs, we're training our dogs or our cats or working with our own kids, they learn to increase behaviors through the use of reinforcement, and they learn to decrease behaviors through the use of punishment. So I like this little quadrant table to kind of explain it a little better. So there are 4 types of consequences after a behavior is performed that can either increase or decrease that behavior in the future. So the first is positive reinforcement. So positive reinforcement means that we are going to give the learner something amazing in order to increase the behavior. A classic example is if the dog, we're teaching the dog to sit, the moment their little tush hits the ground, then we're going to give them a cookie, thereby reinforcing and increasing the likelihood of seeing that behavior in the future. Negative reinforcement is trying to increase a behavior as well by taking something away. So you can see that positive and negative are not like good and bad. They are mathematical. So like addition and subtraction. So positive reinforcement, meaning we're going to give the dog something, we're going to add something to that situation like a cookie. And negative reinforcement, meaning we are going to take something away in order to increase the behavior. The other options are if we want to decrease a behavior, we can use positive punishment. A classic example of positive punishment is, let's say the dog jumps up on a visitor and you have a shock collar on the dog, you give the dog a shock in order to decrease the behavior of jumping on the visitor. Negative punishment means that we're going to take something away in order to decrease a behavior. So let's say we have that same dog that's jumping on visitors and you have the visitor turn their back, therefore taking away the attention, which is what what the dog was seeking. So we're going to decrease the behavior of jumping by taking something awesome away. Okay. The only quadrants that we recommend using are positive reinforcement and negative punishment because the other 2 can be very aversive and can increase fear, anxiety, and stress. But that's a whole other topic and lecture. So let's talk about rescue animals because unfortunately with rescue animals, we oftentimes don't know what their socialization history is. We don't know if they had a trauma history, and we certainly don't know what their learning history was. Did owners take them to, a positive reinforcement class, or did they send them off to a board and train where a shock collar was used on them? Sometimes we just don't know. And so when we get an animal from a rescue or a shelter, it's sort of a spin of the wheel. Like, what are we going to get from this animal behaviorally? In this study by one of my colleagues, Elise Christensen, sorry, I can't talk today. She looked at aggressive behavior in adopted dogs that passed a temperament test. So many shelters have used temperament testing or, Assess-a-Pet testing in order to determine, what is this animal going to look like behaviorally when they get into their new home. And what Elise found was that 41% of dogs that passed the temperament test exhibited lunging, growling, snapping, and or biting after adoption. And when we included when barking was included, that actually percentage increased to 72%. So barking, lunging, growling, snapping, and or biting are all behavioral strategies to increase distance when an animal is feeling scared or feels out of control. And so these animals passed these tests in the shelter setting and unfortunately displayed aggression when they were in their home. So again, just sort of evidence that can't always trust what we see is what we get before us in the shelter or the rescue. And Elise found certain diagnoses we couldn't even test for. So territorial aggression, predatory aggression, meaning they're going to attack prey, and then intraspecific aggression, meaning aggression towards another species. So like cat to dog or dog to cat. So the other sort of side of that coin is, what about rehoming pets that have a known behavior issue? So we know this dog has a bite history. We know this dog has been aggressive to kids, let's say. There are liability concerns for the rescue. So if they are adopting out a dog with a known bite history, that is certainly something that could, come back at them certainly if they don't disclose it. B, even if they do disclose it, if it happens again, that possibility that they could be held liable does exist. And there's liability concerns for the owner as well. Many owners go into those situations going, oh, well, we don't have kids. I just had another case this week, actually, where the owners adopted a dog when they were young. They were in their early 20s and they didn't plan to have children. And sitting in front of me was a couple in their later 20s and a 3-month-old baby. And they have a dog that is a known bite history with children. And so, they went into it thinking, oh, yeah, we'll be fine. But now here we are, and it's a significant concern. So there's a lot of emotional and financial fallout for owners when they adopt animals with behavior issues. So especially with aggression, they may lose their homeowners and rental insurance if the dog's deemed an aggressive dog. They could face eviction if they live in a complex or have a landlord. They may have to rehome the animal. And so that's something that this couple is facing is, they've owned this dog now for 6 years, and it's been a, great part of their lives, but they just can't risk it to their baby, which is absolutely understandable. But now who's going to take on this dog? Now it's a senior. And so who's going to take on this dog? And then the other side of that too is that, if they have to euthanize a dog for behavioral issues, that is one of the most difficult decisions to have to make from an owner perspective. It's hard enough to have to make a decision for medical reasons to euthanize a pet, but when it comes to behavior, I have a lot of clients that really grapple with this because, they'll say, well, quote unquote, it's a healthy animal. Well, yes, they're medically healthy, but they're not mentally healthy. And so that is, something that we discuss. But if you have to euthanize a dog for behavior issues, it does ruin you in the future, potentially. We just had a dog, an owner have to euthanize their dog. It was a young dog, 6-month-old dog, for severe aggression that they had gotten the dog from a breeder. And the mom, relayed to us that, she had wanted a dog since she was a little girl and her parents wouldn't let her have one. And so when her husband and her got married, they decided to get a puppy, sort of as practice child, so to speak. She thought she did her research on the breeder. She thought she did her research on the breed itself. And when we all finally came to the conclusion that it was probably best for them to go ahead and let this dog go, she literally told us she would never own another dog again, that had absolutely ruined her for ever owning another pet. And so, not only are they going to feel guilt for potentially euthanizing that dog for behavior issues or having to rehome a dog, we may be ruining our chances at future adoptions as well. And I want to remind people that love is not all you need. I just had an owner, and I was telling Carrie with YDF, I had an owner a few months ago come in, and they had adopted a dog that was pretty much almost feral. Like nobody could touch the dog. They didn't even see the dog for the first couple months that they owned it. It basically lived in a guest room and never came out. And it had been a year since they adopted it. And they assumed, obviously very wrongly, that, if they just loved it and provided a nice stable home and food and water, that the dog would get over its trauma issues. And unfortunately, the only progress that they had made is the dog would maybe spend minutes in their presence in the same room if the owners were occupied doing something else like watching TV where they were rested and seated. So despite, the love that they provided, and they really, really tried, it's not enough. So remember back to that study by Dr. Burkhart, we talked about with treatment that 50% of the affected dogs could return to service. So not with love, not with wonderful handlers and veterinary teams that adore these dogs. It is with treatment for that PTSD. Only about half of those dogs could actually function again for their jobs. So remember, again, the long-reaching consequences of all of these issues in our pets is some owners lose trust in rescues. I have seen and witnessed firsthand the emotional bullying that some rescues will do to owners that say, we can't keep this dog anymore for whatever reason. They will basically bully them into keeping the dog and or forcing the owners to do the euthanasia versus taking the responsibility on themselves. Many of my clients, like I said, my one client will never own a dog again, period. But many of my clients that have rescue animals with severe behavioral issues will no longer adopt a dog because of that. And so I don't want us to decrease our chances in the future by putting dogs up for adoption that have significant behavioral issues. So that's a very big soapbox issue of mine. And so let's talk a little bit more about PTSD in general and our signs and symptoms that we see. And it goes by the acronym of FAS. So fear, anxiety, and stress. And so what does that look like? It's much more than FAS, though. So with these animals with PTSD, they show strong physiological responses, elevated heart rate, blood pressure, panting. They show impaired extinction ability. So extinction is where we are trying to get rid of a behavior or an emotional response. So let's say a dog that is terrified of plastic bags that are blowing in the wind. In order to try and get rid of that reaction, we may try and extinguish the behavior by just continued exposure. And that doesn't work with these dogs. They show high levels of avoidance. Like I said with Luna, she would avoid for days going outside if she saw a plastic bag roll across the street. They show cognitive and mood changes. So where you might have had a very sweet snugglebug dog before, now we have a dog that is aggressive if you try and touch it when it's resting, or is just more irritable in general. And we see an increase in arousal levels as well. So hypervigilance, aggression, and sleep disturbances. And humans report a lot of sleep disturbances with PTSD. And I suspect that our patients also are operating on pretty low sleep levels as well. So let's talk quickly about what fear and anxiety are and what sort of the difference is between those two, because it's a very common misunderstanding that they are one and the same. So fear is an unpleasant emotion caused by the belief that someone or something is dangerous, it's likely to cause pain, or presents a threat. And it is something that is actually there, has happened in the past, and or the animal can see it in front of them. And anxiety is a feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. However, anxiety can be real or imagined. So people that are afraid of flying because their plane might crash. How often does a plane crash? Thankfully, knock on wood, not very often, right? And so that's more of an anxiety issue. But my fear of spiders is very, very real because I grew up in Arizona and we get the most enormous wolf spiders on the face of the planet that will literally come out of the drains. And so my fear of getting into a shower and that there might be a spider there is very much a real thing. So it's not just an anxiety issue because it's not something that I have imagined. So how do we respond to a threat? So we most commonly hear like it's fight or flight, right? So this is a physiologic reaction to a perceived threat to survival. And whether you decide to flee or to fight is going to depend on the speed of that thing that is threatening to you. It's going to depend on the distance away from you to the threat. It's going to depend on the characteristics of the threat. It's going to depend on previous experiences with that threat. And it's going to depend on your ability to flee. So a really common example that I talk to owners about all the time is we see dogs that are very, very reactive to other dogs on leash, right? So they're attached to their mom or dad by their leash. They are lunging, barking, growling at other dogs. But you put that dog in a dog park or in a backyard with another dog, and they're able, off leash, they're able to run around and actually play. And that's because we have impeded their ability to flee via that leash, right? And so it's like, well, look, I can't flee because mom and dad have a hold of me. So I'm going to have to look really big and bad and act like I'm willing to fight. But we can also see two other responses, freeze or fidget. So freeze is very, very commonly seen in the veterinary clinic, which is why I put this picture up here of this cat. Our patients oftentimes will just shut down. It's called learned helplessness, where they're like, okay, well, I can't do anything about it. I know the vet is going to do all this stuff to me, and nothing that I have either tried in the past or that I think I should try is going to work. So I'm just going to shut down and sort of take it. Owners oftentimes will say, oh yeah, the groomer and the veterinarian said, my dog was fine. Well, fine doesn't necessarily mean that they lack fear. It probably means that they were frozen. So we got our jobs done as veterinary staff or groomers, but they were really, really scared despite that. And so then the other one is fidget. So these are also called displacement behaviors. So you can see licking behaviors, grooming behaviors, excessive exploring or excessive scratching. People oftentimes do displacement behaviors. They may twirl their hair or, pick or bite at their cuticles or nail beds. Those are really common displacement behaviors in people. So some more pictures about what fear and anxiety looks like. So these dogs are displaying what we would consider as fear. Our top left dog has what we call the whale eye, where it's looking out of the corner of its eye, but you can see a ton of the white of their eye. Dog and the Dalmatian on the bottom, same thing, and it's hiding behind the couch. The dog on the top, the little Cocker Spaniel-y looking thing, it's crouched, its tail is down, almost tucked, and they've got their little worried, wrinkled brow. I love these two graphics by Lily Chin, and you can get both of these on her website. One is the body language of fear in dogs, and the other one is the body language of feeling anxiety. And we have these posted in our exam rooms so that owners can go, oh my gosh, wow, I see my dog yawn a lot. And I'm like, yeah, they're not tired because, that's not normal when you're not tired. It's because they're stressed and they're trying to displace that stress and minimize that for themselves. So for our kitty cats, you can see the eyes and the whisker position is different, whether they're crouched, where their tail is being held, all that kind of stuff. So body language is very, very important to understand, to read your pet or your patient in order to realize, are they fearful? Are they anxious? And do we need to minimize those signs of fear and anxiety? There are long-term consequences of chronic fear and anxiety as well. So there's a lot of research in the human world and the rodent world, and we're getting more research in the dog and cat world that shows that chronic stress can suppress their immune system. It can lead to anorexia and weight loss. So appetite oftentimes is suppressed in animals with stress. Definitely leads to that insomnia, which leads to increased irritability. And then it also leads to premature aging and a decrease in lifespan. So there's studies to show all of these things. So how do we modify or change that emotion from fear, anxiety, and stress to either neutral or positive? And that's typically through desensitization and counter conditioning. So desensitization is where we want a diminished emotional responsiveness to a negative or aversive stimulus after repeated exposure to it. So that's called desensitizing. And then it's often paired with counter conditioning. And counter conditioning is where we're replacing an unpleasant emotional response to a stimulus with a more pleasant adaptive response, and oftentimes through the use of food, which is a primary reinforcer in our animals. So trying to change that emotion to either a good one or at least a neutral one. We can also use products and medication. So there's a lot of products out there designed to help with fear, anxiety, and stress. These are just some of the more common ones that we recommend. The kennel on the left is really designed for dogs that are noise phobic. So it has sound deadening foam in there. You can put the dog bed in there if you need to put it in their little safe haven that already exists, like in a closet or the bathroom during a thunderstorm. The makers of Thunder Shirt, which you're probably all familiar with, also make the Thunder Cap, it's now called. And so it's that material that goes over the eyes. And so this is really good for like veterinary visits, travel, dog reactivity. It's not a total blinder, but it does definitely dampen visual signals. The earmuff or, headphone looking things at the bottom left, those are called mutt muffs. So those are noise canceling headphones. All of our military working dogs were trained to wear these because we had a lot of helicopter work on our base. And so the dogs would all get their little mutt muffs on when they went up in the helicopter. And so that's a way to really help dampen some of the sounds. It is absolutely something that has to be trained, though. It's not something you could put on your dog and expect them to want to wear from the get-go. Through a dog's ear and through a cat's ear are bioacoustically modified classical music that is supposed to help dogs and cats calm. And we saw the evidence of through a dog's ear in our surgery kennel at the last specialty hospital that I worked at. They started playing through a dog's ear in their recovery ward, and they found that the dogs were less vocal and actually slept much longer post-operatively than they did previous to using the music. And then I must be a cat in another life because I love to sleep through a cat's ear. So I love it. I think it's so soothing. Medication and products like nutraceuticals, pheromones, which we'll talk about. The goal of these is to decrease the intensity of that emotion that's driving the behavior. So we're going to decrease the intensity, hopefully the frequency, but generally speaking, I find that the frequency most often decreases with the behavior modification plan. And we're also going to decrease the time of recovery after an animal is triggered. So instead of taking days for Luna to come, to exit out the house after she saw a rolling plastic bag, maybe it's we get to go back into the lobby, she recovers, and then we can go right back out. So that's kind of the goal of those. There are two types of medications and products. There are daily meds that you take every single day. It does take a longer period of time to see effect with these, and depending on the product is going to depend on how long that is. And then event medications are those that are given just prior to a stressor. So, and we'll talk about examples of these, but, for like veterinary visits or thunderstorms, it would be given just prior to that event. Most common side effects, if we see anything with our psych medications and products, do tend to be gastrointestinal, so vomiting, loose stool, or appetite changes. Others can happen, but they're very, very rare. And so, I just had an owner said she picked up her gabapentin at the pharmacy, and it came with 2-page list of all the possible side effects that could happen. And, she rightfully was like, I don't want to give this to my dog. And I was like, look, it is much, much more rare side effects. These are like 0.1%, but they have to list them. And so it is very, very rare that we see issues more so than gastrointestinal. These meds and products that we use are extremely safe. We don't worry about long-term organ damage, and they can be used lifelong, depending on the pet. So let's talk about some of these products that we use. I'm highlighting some of the newer ones out on the market. So pheromones are chemical messengers that are sent to members of our own species. So Feliway Optimum is the newest diffuser from the Seva Corporation and the Feliway family. It's the combination of the facial pheromone, which is what cats deposit when they're rubbing their whiskers on things, or bunting is called, as well as the maternal appeasing pheromone that mother cats produce when they're nursing their kittens. So this diffuser lasts about 30 days. You plug it into an outlet, and it diffuses that pheromone into the environment, helping to calm, and reduce signs of stress in cats. Zenadog by Verbac is the newest dog pheromone out on the market. This is the maternal appeasing pheromone in dogs. So it's what mother dogs produce when they're nursing their puppies. And this is a gel diffuser. So instead of having to plug it into an outlet like the Adaptil products by Seva, you just set it out, open up the little brown top, and it just diffuses into the air. It lasts for 2 months, and that gel will go down as it, basically is released into the room. So both of these products we carry on our shelves because they do have evidence behind them, and they are very effective and safe. Then we have some nutraceuticals. So nutraceuticals means it is made of a food component. So Zilkene by Vetaquinol is in alpha-casozepine. So alpha-casozepine is a protein found in cow's milk. So if you've ever heard of the saying of drink a warm glass of milk before you go to bed, the reason that saying exists is because alpha-casozepine does bind to the same receptors in our brains that the medications Xanax and Valium and Ativan, that class of drugs, binds to. So this is a once daily supplement for dogs and cats. You can see the picture on the front. It's a little capsule, and you can either break the capsule open and sprinkle it into a little dollop of canned food or, tuna for kitty cats, or you can hide the capsule in like a pill pocket like you would normally for any other pills. Angstine by Verbac is an L-theanine supplement. L-theanine is an amino acid found in green tea. A lot of people drink green tea for its anti-anxiety properties, and the reason that it works is because L-theanine increases serotonin, which is our coping neurotransmitter. It increases dopamine, which is kind of our pleasure neurotransmitter, and it increases GABA, which is our inhibitory neurotransmitter. This is a chewable tablet. A colleague of mine, Teresa DePorter, calls it kitty crack because it is very, very palatable for kitties. And cats, if you've ever owned one, are difficult to give medications to. And so if you have something that they will gobble right up willingly, it is really, really nice. This is the product that I was mentioning that we did our study on during my residency for its use in thunderstorm phobic dogs. There are some dietary therapies out there these days. Royal Canin has their Calm diet, and Hills has their CD multi-care urinary stress formula, as well as their digestive care ID stress. All 4 of these products have alpha-casozepine, so that product that I mentioned that protein that's in Zilkene. All 4 of them are in here. And then the Calm diet, as well as the CD multi-care urinary stress diet, have added levels of tryptophan. And tryptophan is what our bodies use to make more serotonin. There are probiotics. This is my literal favorite area of science right now, is how fascinating the gut-brain connection is. And so this is a particular bacteria called Bifidobacterium longum that actually communicates via the vagal nerve from the gut to the brain to decrease anxiety. So Purina has their little packets. If you've ever used their Fortiflora probiotic, it's very similar, same palatant. So it's very, very palatable. Cats and dogs both love it. And so this is a probiotic that you can give to help with anxiety issues. Unlike other probiotics, so probiotics that we give for gut health, those are oftentimes colonizing bacteria, meaning you give the probiotic, it colonizes the gut tract, and then it's going to stay there until something disrupts that gut. Maybe the person takes an antibiotic, or the dog or cat rather, and then it gets rid of that. But this one in particular, this B. longum, actually is not a colonizing bacteria. It only works as it is traveling basically from front to back. And so if it works, you have to continuously give it. There are 2 FDA-approved daily medications for use in dogs. Unfortunately, we don't have any approved for use in cats, psych meds yet, but maybe someday. So we have Clomicalm by Verbac, which is a tricyclic antidepressant, which is FDA approved for separation anxiety in dogs. And then we have Reconcile, which is PRN Pharmacal's branded fluoxetine, which is an SSRI, which is also approved for use in separation anxiety in dogs. Again, a whole talk of, what we could use these for off label. These are Reconcile for sure is one of the most common medications that we use in our practice, as well as I've heard other veterinary behaviorists say the exact same thing. But that being said, we're not just using it for separation anxiety. We're using it for aggression, for compulsive disorders, etc. Then we have those event medications, and I listed sort of the common ones that we use on the left there: trazodone, gabapentin, clonidine, our benzodiazepines like Ativan, Xanax, Valium, and then beta blockers like propranolol. But we only have 2 FDA-approved event-based medications. The first one is Cilio, which is oral transmucosal dexmedetomidine. So it is a gel that's actually FDA approved for noise phobias in dogs. And basically you put the gel inside the cheek pouch at the first sign of stress associated with a thunderstorm or fireworks display. And the gel absorbs directly through the gums into the bloodstream, and therefore is active within 10 to 15 minutes versus having to take a pill that, have to obviously go into your stomach, get broken down, then go through the liver, and then into the bloodstream. So this is a really nice formulation for especially thunderstorms, I think, because we don't necessarily have 90 minutes to 2 hours of lead time to know that a storm is going to happen. And so, at the first signs of distress, when the dog hears the thunder miles and miles away and we haven't even heard it, we can go ahead and administer the Cilio gel. And then hopefully this year, we will actually have Pexion on the shelves. It's already been FDA approved. Now for a couple of years, I believe. It's been approved for use in epilepsy as well as noise phobias in dogs. It just hasn't quite been manufactured yet. So they were not anticipating FDA approval to come so quickly. So let's get back to Luna. So remember our little 9-month-old burner. Luna, when she came to me, we started her on sertraline, which is the generic of Zoloft. And so I was using the human drug. She was started at 25 milligrams twice a day, which was about 1 milligram per kilogram dose. We did give her some alprazolam, which is Xanax, and Cilio as needed for any panic attacks that she might have. She was also started on Zilkine, the alpha-casozepine supplement, at 2 capsules once a day, which was her by weight dosage. The owners had already started the Adaptil product. So this is the Seva maternal appeasing pheromone product. So they had a diffuser plugged into their apartment. They had a collar on her. And we did begin some desensitization and counter conditioning to some specific triggers. The first being the vehicle, because Luna was refusing to get into the car, rightfully so. And so we were trying to work on that because the owners did need to drive her to the veterinary clinic. They needed to be able to go visit their parents, which were, a few states away. And we were trying to do this in the city, which unfortunately is a very busy, if you've never been to DC, number one, you should, but number two, it is a very busy area. And so there were tons of noises, tons of things that she would experience on a regular basis. And we were really just unable to keep her under her threshold. And so the progress that we made was very minimal with her. And so now where is Luna? Unfortunately, her owners did make the very tough decision to rehome her. The breeder is actually a veterinary school classmate of mine, which is how Luna found me. And so she knew of a family who also had burners up in upstate New York in a very rural area where she would not experience all these triggers to her issues. And so The couple did drive her up to upstate New York, and she was adopted by the family up there. She is doing very, very well. She is on currently sertraline. She's still taking 50 milligrams twice a day. So even though her environment is much better for her, she still needs the sertraline on a regular basis. They very rarely have to use the Xanax or the Cilio for panic attacks that she might have. She's no longer taking the Zilkine or using any of the Adaptil products. And to be frank, they have not done a lot of behavior modification at all, but luckily her triggers are very minimal up there, which is wonderful for her, but very sad for her family here. So one of the things that I have, of course, everybody's been talking about is what's going to happen to all of our COVID puppies, right? A lot of people, myself included, got a puppy or adopted a dog or cat during COVID. And so these animals, despite our best efforts, weren't, readily socialized. Oftentimes owners were not leaving them at all, right? They never left their house. So dogs, especially our dogs, were never learned that their owners left the home without them. And so one of the biggest concerns that we have as veterinary behaviorists is, are we going to have a bunch of dogs and potentially cats with separation anxiety and fear-based aggressions because of that lack of socialization to sort of normal lifestyles, people coming over to your house, dinner parties, things that we are starting to, get back into the habit of having, but that for years, we really didn't actually experience with these animals. So the sort of data remains to be seen. I do know that a couple of my colleagues are collecting data to kind of see what the outcomes are going to be from this time period. But it's really, I think it's going to remain to be seen, and it's really going to depend on a particular pet's resiliency. So my Airedale she was purpose bred, and her breeder does a really, really good job of exposing the puppies to certain stimuli, and she does early neurologic stimulation, and she raises the puppies using a program called puppy culture, where they are well socialized prior to them even coming to their new homes. And they're fairly bomb-proof, these puppies are. And so while Ginny, my dog, was very rarely left alone, she can easily be left home alone, despite the fact that we never really practiced it, because how could we? We weren't going anywhere. Well, at least my husband wasn't going anywhere. I was still going to work, but the kids were home. My husband was home. For the most part, she's pretty good with people coming over to the house too. Again, something that we didn't have a lot of practice with during that early time frame. And despite my best efforts, knowing what I know, I tried to socialize the heck out of her, but it was nowhere near the amount of socialization that I've done with previous puppies. So again, if an animal isn't resilient, they are maybe predisposed to anxiety, they never had these learning experiences, it's very possible that we might be experiencing a high level of dogs and cats with separation anxiety and fear-based behaviors. So really important to know that, as an owner, dogs and cats are not just going to grow out of their anxiety issue. So it's not just going to get better as they get older. I tell clients all the time, they don't grow out of it, they grow into their anxiety. So waiting is just going to, be that much longer that the animal is going to have to suffer, but also that they are going to have, learning taking place that, every time I encounter something scary, it's something scary, right? So it's really important that you seek immediate help from your veterinarian and a trainer, and certainly from a veterinary behaviorist for the best chance of success. And one article that I really want to point out to you, written by one of my colleagues, Lieutenant Colonel Desiree Broach, who is also a veterinary behaviorist, and she is in the Army. She posted an article for Pet MD called Military Working Dogs and Understanding Canine Post-Traumatic Stress Disorder. And it's a really good read, and I would highly recommend that you go read that after today's lecture. So with that, I'm going to turn it back over to Deb, and she's going to read out our questions.
let me start with the last one.
Oh, okay.
How do people find veterinary behaviorists around the country?
Great question. Thank you for starting with that one, Deborah. I love it. So you can actually go to our college website, which is DACVB, so Diplomates of the American College of Veterinary Behaviorists. .com, .org, dacvb.org, and it'll say find a veterinary behaviorist near you. You put in your location and it'll and a radius that you want it to search. But you can also ask your local veterinarian. So while there may not necessarily be a veterinary behaviorist close to you, they may know of one that they either worked with in the past or at their veterinary school where they went that they can consult with, or several of my colleagues are able to consult via telemedicine. Like Chris Pockle is able to do telemedicine with clients from his practice in Portland. Lisa Radasta, I believe, can do from her practice in Florida, and Elise Christensen can do it from her practice in Colorado, whereas the state of Virginia does not allow us to do telemedicine to establish care. So unfortunately, myself and Dr. Sin, we are limited to in-person visits. So great question.
Is Dr. Reich still practicing?
She is still practicing, but she's not taking new patients.
Okay. But we do have the two of you, plus we have two resident veterinary behaviorists, and then Dr. Rupsky, who will be taking her boards this fall.
Exactly. Yeah, we're very lucky in this area to have so many. Other areas are not so fortunate.
Yeah. Okay, let's get to other questions. Tammy has a pit mix that's 5 years old, and she's wondering, how does she deal with socialization skills at this point?
Yeah. So unfortunately, the socialization window has definitely closed because, like I said, it's about 12 weeks of age. And so at this point, it really is about desensitizing and counter conditioning to either the presence of another dog, like let's say on a walk, but it may be one of those things where, especially depending on how fearful or aggressive your dog is towards other dogs, that they may never be able to be introduced to other dogs. So our focus may be more on getting them to ignore other dogs when you're walking, or if you're like walking by a park or something like that. So I would definitely work with a qualified trainer that uses positive reinforcement-based training to work on reactivity, but this is not necessarily something that we can fully change in terms of like making your introvert into an extrovert.
I believe that we have some reactive dog classes coming up. You can check on our website under Schedule at a Glance, and that could help at least some of you. Okay, Maru has she has a German Shepherd who started puppy classes at 8 weeks, ongoing classes in 2020. 6 months later, she couldn't get training until 4 months, for another 4 months. During the gap in training, she became very protective of her loved ones and her, and she does not like other humans.
Yeah. So a couple things are at play here. Number one, it's a German Shepherd. There are dogs that are purpose-bred for certain things, and as a breed, they are, purpose-bred for guarding and herding behaviors. So there's some normal behavior at play there potentially, but also between 6 and 10 months of age, dogs go through a secondary fear period where things that were not scary before or that they had been socialized to potentially now are scary. So we will see this really commonly from our clients. They're like, gosh, they were just a very, very social dog until 9 or 10 months of age. And that's because of that secondary fear period that's occurring. So that is a really sort of common complaint. And at this point, it is all about desensitizing and counter conditioning, as well as managing the dog's behavior so that we don't, put the dog in a situation that it doesn't want to be in.
Yeah. Okay. Here's another one that is somewhat similar. Marcia has a 7-year-old border collie Pomeranian mix that has been abused and was going to be euthanized. So her mom got her this dog, but her dog is nipping people, everyone except for her and her mother. And she doesn't know what to do about it.
The first thing you can do is manage the behavior. So your dog is telling you with its behavior that it doesn't want to meet these other people. So if you have people over, in order to prevent the practice of that, you want to make sure that you confine the dog. If the dog can't be confined, you're going to have to train the dog to be confined and be, either neutral or happy about confinement. And then it may be a case where, depending on your lifestyle, if you do have a lot of visitors, you may really need to do, some pretty intense training and potentially consider some medications and products through your veterinarian or a veterinary behaviorist in order to help change that emotion.
Here's another question about having construction work happening outside, which makes walking her dog difficult.
Yeah, that can be a really tough situation. I know DC folks experience this quite a bit. You may need to hop in the car and go somewhere else for the walks. Now, maybe you can go out a back door and, down an alleyway for elimination purposes. But if you really wanted to go on a walk, maybe go find like a hiking trail, or there's a great app now called Sniff Spot. It's kind of like an Airbnb for enclosed spaces where you can go and you rent by the hour or by the half hour, and that you're the only people that are there at that time. And if your dog is social with friends' dogs, you all can get together and share in the cost and head out to sniff spots and have some fun time. But that may be a situation where you have to kind of manage it until the construction's over.
And Debbie wrote something interesting. She gave the history of her dog, a husky who is now 8.5 years old. And for a variety of reasons, he's very wary of other dogs and always chooses to go the other way, which she says, of course, they do. What I like about this post is that she said, at the end of the day, I just respect that his world is small and happy, and that's okay.
I love that. I talk about this with clients a lot is, the difference between wants versus needs. I may want my dog to go to the winery or the brewery with me, but that's not something that he wants to do, right? And that is my want, not his. Whereas you need to go to the veterinary clinic. You need to be able to be seen and, achieve health care. And so that is absolutely something that if your dog is terrified of going to the vet's office, we need to work on that. But if you come to me saying, I just want to be able to take my dog who doesn't like other dogs to the dog park, that's not something we need to work on. That's not okay because, again, it's your want versus theirs. So I love that she's willing to accept the dog that she has in front of her.
Yeah, there are, at least in the DC area, some mobile vets who will come to you. I don't know if they can do everything.
It depends on the mobile vet. I've seen some that have surgery on their vans. I've seen some that have x-ray on their vans, but some don't.
What is the name of the sound deadening kennel that you mentioned?
So the Thunder Hut is one brand, but there's a number of different brands out there now. I think Ford even has one that they've made. So there, you can just Google sound deadening kennel for dogs or sound dampening.
Do you think any calming music for pets would work, or specifically should it be through a dog's ear or a cat's ear?
So I do really recommend Through a Dog's Ear and Through a Cat's Ear because they legitimately studied what range of pitch and tone that dogs and cats hear at and what is going to calm them. But there's another study out there that I think looked at music chosen in a surgery suite, and reggae tended to calm the patients under anesthesia. So, you could, if it works for your dog, that's why I always say with behavior is like, if it works, great, because I don't care if it's a placebo effect or not. Like if your dog calms to listening to Queen, absolutely have at it.
Through a Dog's Ear has a reggae tape.
Oh, do they have a reggae one now? Oh,
yeah,
great.
it surprised me. You can find this Googling Through a Dog's Ear, but it's now called ICALM,
yeah.
ICALM, Calm Pets.
Yeah, it's like a little Wi-Fi speaker now. We have them in all of our exam rooms, playing the music for when we have our consultations.
Mm-hmm. And if you're with a rescue, they also have a rescue program where you can get, I believe, a reduced cost or shelter, reduced cost music from them. Okay, Maru needs to travel by plane with her dog, and oh boy, wait a minute. Was my Francine, my previous GS service dog on planes with
German
me.
Shepherd, maybe? German Shepherd, GS?
Yeah, it must be.
Well, I can just answer a general question about traveling on a plane, Deborah.
Okay, good.
Maybe other people have a similar situation. So depending on the size of your dog and it's whether it's a service dog or not, just a pet, is going to depend on whether it can ride in cabin with you or if it has to go under in cargo. And so if your dog's going to have to ride in cargo, there's a lot of different restrictions. Specifically, they would have to ride in an airline approved crate. So you'd have to get your dog crate trained. They cannot be sedated. So you can use anxiolytic medications. So we oftentimes use gabapentin or trazodone for those dogs, but we can't use things that sedate them to like literally just make them sleep the whole ride, because when you're sedated, you can't regulate your body temperature as well. And so that is actually illegal. It is actually very hard to find airlines nowadays that will even ship pets though. So United has stopped doing it. I think Lufthansa does still do it. Turkish Airlines, I know, does it because I just had a client that's going over to Turkey, but it's very, very limited. I think Delta may do it within the States, but there's only certain times of the year that they can go because of the temperature outside. So they can't go when it's too cold. They can't go when it's too hot. If your pet is riding in cabin, if they're not a service animal, they will have to be in a crate. So it'll have to be a crate that fits under the seat in front of you. So you would have to train your dog to do that. You would want to make sure that your dog is comfortable with noise because it's very noisy on a plane, whether they're in cabin or below. It's hard to really mimic and desensitize to those situations. Unfortunately, we have a lot of clients that are State Department or military, and they're constantly traveling overseas with their pets. And we have not found a great way to really mimic a plane ride itself, so that we can work on this previous or prior to. If they're in cargo, they have to be handled. The carrier will have to be handled by people. So there's a lot of sort of moving parts that you have to go to. Now, if your dog is a service dog and actually does perform services for you, they are legally allowed to go in the cabin no matter their size. And if they're a service dog, I would hope that they are behaviorally sound enough that they can tolerate other people being nearby, potentially other pets, screaming children, kicking on the seat behind you, that type of thing. But it's one of the most challenging situations for me as a veterinary behaviorist to deal with, because it's very complicated to get a pet in an airplane.
There was an article in the Washington Post maybe a month ago
I saw that.
about a pet, well, two different pet airlines. One of them, you would have to find other people going from your place to, it was mostly like Europe to DC, to not to DC, to the United States, or, back and forth. But people were easily finding enough to fill the plane. But then there's a new one starting where they do the work for you, finding other pets that need to go in the same direction. And
Pender Air does that in our area. They're a really good pet service, but it is not cheap for sure.
No, try, any of you who are interested, try Googling the Washington Post pet air travel.
There's a
and
good
you
article.
may be able to find it that way. It wasn't cheap, but I think, and they travel in the cabin.
Yep.
So at least you can look into that. Because I was amazed, and I wrote it down, but not any place that is anywhere
handy.
Oh boy, how many of these medical natural substances can be used together?
So the almost all of them can be used together. It's going to depend on what neurotransmitter they target. If you have to be worried of things like serotonin syndrome, but like the natural over-the-counter things that you can easily use together would be the pheromones, zilkene, and angstine. And I often, I do see the most severe cases, obviously, as a veterinary behaviorist. And if owners are either hesitant to use medications or maybe the dog isn't as severe, I typically will combine all three of those products together.
These are two similar questions, and you may have just answered it, but I'm not sure. One is, do you have any concerns about pheromones interacting with medications? Is it safe to use both? And the other is, can nutraceuticals be used with daily meds?
Yeah, so kind of similar. Pheromones can be used with anything. They do not cross-react. You can use a dog pheromone in a room that has cats because the cats will not recognize that pheromone. So like a lot of veterinary clinics, they don't have a dedicated cat exam room, but they will have both the Feliway and the Adaptil or the Zenadog in those rooms. The nutraceuticals with medications question is a bit more complicated because you do have to know which neurotransmitters they target. And if you are essentially going to potentially overdose on that neurotransmitter, there can be issues with that. So it would depend on the medication, and it would depend on the supplement.
Okay. I need to look up something to get back to you for this one about the plane. She got back to us, but do you remember the question about the puppy early on?
A little bit, maybe.
Yeah. Okay, wait a minute.
The one that was aggressive at like from 6 to 10 months? Is that the one?
Here, the German Shepherd.
Yes.
Who went to classes and then stopped, and during the gap became very protective.
Yeah.
And doesn't like other humans.
Yeah.
That is the dog
that has to go on the plane.
Yeah.
Yeah. I mean, to me, that is unfortunately a dog that maybe not fit for service work. I'm just going to be frank about that, because if it can't be in situations where there are a lot of other people, it can't function. And that's not fair to the dog. It's not fair to the public. It's not fair to you for the services that you need it to perform. So I would definitely, be speaking to whoever you got the dog from, what organization that was, and maybe figure out if that dog doesn't need to be a service dog anymore.
It sounds like it. Okay, where are we? Again, you may have, it says, can we give L L-theanine, is that how you say it?
Yeah.
And tryptophan together.
So I wouldn't recommend it because tryptophan is the precursor for serotonin. So depending on what product you're using, there are tryptophan supplements out there that are just tryptophan. And so I wouldn't recommend that, but I have used L-theanine with like the Calm diet, which has added levels of tryptophan. They're at a level where we're not concerned. So you would have to know dosage. You would have to know like these, even though these are nutraceuticals and they're supplements, they are safe for the most part, but they do have, chemical interactions. And so you definitely want to talk to your veterinarian about that.
Okay, and Elizabeth sang your praises and said that her dog Finley is doing so much better.
Oh, yay, Finley.
She suggested that people see veterinary behaviorists.
Thank you.
Okay. Barbara has a rescue Shih Tzu mix, about 6 years old, that she adopted 2 years ago. He was found as a stray. He's extremely car reactive. If the car is moving, he barks, runs in circles, and sometimes bites her on the leg or attempts to. Because of this, I can't let anyone walk him.
Yeah.
If I'm going to be gone for more than 7 hours, I have to take him to doggy daycare. This issue also sometimes extends to planes he sees in the sky and even flying birds.
Goodness.
She's tried 2 dog trainers, no help whatsoever, and took him after I had him for a couple of months to a behaviorist. We probably tried 6 medications, none of which helped. Any suggestions? I am open to trying another trainer if you know of any in the central New Jersey area. I cannot drive with him alone in the car because even before I pull out of the garage, he's shrieking his head off, even though he has no problem actually going into the car.
Oh, poor guy, and poor you too. I don't think this is a training issue. I definitely think this is we have not hit the nail on the head yet with the medication. And so, if you are working with a boarded veterinary behaviorist, definitely get back with them. If you're not working with a boarded veterinary behaviorist, that's who you need to go to. Sometimes the term behaviorist is thrown about sort of willy-nilly, and they're not like myself and my colleagues who are boarded. So, but again, you get back with them because there's other options.
Since she has trouble taking her dog anywhere in the car, what about the 3 who work online? Would that?
Yeah, that would work. Yeah. Or like for my clients that, because we get clients from Pittsburgh and North Carolina and, Pennsylvania, everywhere coming to see us from a ways away. We don't have to see them back in the office physically, but annually. And so we can do everything via telemedicine after that initial appointment. So their veterinary behaviorist may also be able to do that as a follow-up option. So I would definitely ask.
Okay. And can you mention again the vets that you mentioned earlier?
Yeah. So Dr. Chris Pockel's practice, which is the Animal Behavior Clinic in Portland, Oregon, Dr. Elise Christensen, and she has locations in Denver and New York City. It's New York Behavior Vets and Colorado Behavior Vets. And then Dr. Lisa Radasta, it's Florida Veterinary Behavior in south of Florida. Southern Florida, I guess.
So does that mean they would never have to show up for an in-person?
Yeah, they don't have to show up for an in-person.
Okay.
Yep. What
does a panic attack look like in a dog?
Yeah. So it's similar to if you've ever witnessed one in a human. They might be breathing really rapidly. If you felt their heart, it'd be pounding out of their chest. They're going to be really, really hypervigilant, potentially trying to escape, any area that they might be confined in. They may attempt to hide. They're not going to eat. They may poop or pee themselves. it can be really, really scary to watch.
Okay. And actually, some people on chat gave good answers.
Oh,
Some of the
nice.
people who are listening.
I like that. I actually think I saw
I
one of
know
my
that
colleagues is
you,
in chat, so that's good.
I know that you said, oh, yeah, Dr. Eng. I know that you said not to expect a dog to grow out of it, but what about a newly adopted dog that seems anxious in certain situations, but has gotten better as she gets more comfortable? Could you expect she will get better as she is desensitized to new and scary things?
Yeah, if it's gone about the right way. So there is a fine line between desensitization and sensitization. So, if you push that animal too hard into situations that push it over its threshold, you can actually make it worse. And so I would definitely, work with a qualified trainer or veterinary behaviorist to make sure that you're doing everything appropriately so that we do have that higher chance of getting through it. But that's not growing out of it. That's actually working on it. So while you said the dog's gotten better, it's because again, they're more comfortable in the home, but you're actually working on it and not just assuming it's going to grow out of it.
This sounds difficult to me.
No.
If you have to board your dog, do you think regular daily routine, along with other measures, can be helpful in dealing with dogs who have PTSD or other anxiety?
So structure and predictability are important for any animal with anxiety. Those of us people that are anxious also thrive off of structure and predictability and don't like, things to crop up suddenly or, surprise us out of nowhere. So yes, that can help. I guess I don't understand the boarding portion of the question though.
I guess they're going away and they don't know what to do.
So you really need to vet your boarding facility. So there are, at least in our area, there are a ton of boarding options, only a handful of which are actually appropriate for dogs with fear, anxiety, and stress. So you need to make sure that, they're going to be in a quiet space, that they will have all their needs met, that if it's an animal that doesn't like people. So, we have some of our patients that nobody other than the owner can touch. And so if the boarding facility can accommodate that, meaning the dog can go in and out freely, they have an indoor and an outdoor portion of their run, and really does not have to interact with a human if they don't want to. It just depends on the particular case, but ask your veterinarian who they recommend. If you know trainers in your area, ask them who they would recommend. If your dog goes to daycare, then your daycare may do boarding. So there's lots of options.
We have a section on our website that is boarding and vacation care.
Good.
And often you can get someone either will take a dog into their home or will come to your home.
I also tell people to ask.
Some of them will even stay over.
Yeah, I tell people to ask at their veterinary office because many vet technicians and vet assists will board or stay at your home.
Yeah. I mean, that's preferable to putting your dog in a kennel. I think for anybody, but
yeah,
especially a dog with PTSD. Dara wrote back about the new dog that you just talked about. They've only had the dog for 3 weeks.
Oh, so it's still very early. So animals and people will honeymoon when they're in a new situation. And so for dogs and cats that are newly adopted, we recommend it's probably going to be a 3-month period of time of them getting used to their new surroundings. And so you may start to see new behaviors, good or bad, in that 3-month window. So it's rather early still.
Bonnie has an appointment with a veterinary behaviorist on Monday.
Oh,
She
good.
submitted the behavior history. The appointment will last as long as 2 hours, and she's wondering what to expect from the initial consultation.
Yeah, we all sort of run our consultations slightly different, but they're going to go through the history with you, and sort of delve into anything where they have further questions about it. They're likely to go over the reasons why your dog is experiencing the behaviors that you're there for. They're going to go through a lot of like, what have you done? What have you tried? What has worked? What hasn't worked? Certainly, if there's any medical concerns, they're going to dive into that because as veterinarians, that is sort of where we excel over like a trainer is determining if there's medical underpinnings to the behavior concern as well. And then they'll go through treatment options, diagnoses, and talk to you kind of about the plan moving forward. They may teach you about body language and how to read your dog, and determine what the triggers are and how we can manage those. So my consults are about an hour in length, but that is after they have already spent about a half hour, 45 minutes on the phone with a trainer, with one of our staff members, going through the history and figuring out what management can be put in place before they see the veterinarian. And then they also go through a body language training as well so that they can learn to read their pet. And then, so with me or Dr. Eng, or Dr. Learn, then at that point they are we're simply going through the diagnoses and the treatment options moving forward.
You may also want to mention that although these appointments seem expensive, you're available afterward.
Yeah, most veterinary behaviorists, still will answer emails and that kind of thing afterwards. In my residency, we offered 3 months of follow-up that was included with the fee. It really does all depend on the veterinary behaviorist. And there's a reason they're expensive too, just because the amount of training that we had to go through. So not only was it veterinary school, it was an internship or equivalent general practice experience, and then a 3 to 8 year residency and taking and passing this grueling board exam.
And be very careful, everyone, about people who call themselves behaviorists.
Yes.
Because there are a lot of trainers who say that they're behaviorists and they aren't.
Yep.
How far in advance are you and other behaviorists taking appointments? Oh, God.
So it used to be actually pretty bad, but since we switched our appointment system, we're usually booking about 3 to 4 weeks out. I know that Dr. Sin is probably 4 to 6 months at this point. I don't know about Dr. Ropsky or Dr. Connolly. Dr. Learn down in our Richmond facility is about a month out as well.
Whatever you did to your appointment system, could you share that with the rest of you?
Well, I will say it takes an army of staff. I have about 17 employees, whereas most veterinary behaviorists don't have a big hospital like we do.
And I guess you can't farm them out.
No, okay. I know. I will not share. I resource guard my staff.
Okay. I wanted to ask you about when you were talking about learned helplessness.
Yeah.
I wanted you to mention how training certain types of training can also lead to learned helplessness.
Yeah.
Just as a warning.
Yeah, no, absolutely. So punishment training with the use of punishment techniques or tools like a shock collar, prong collar, those types of tools can absolutely lead to learned helplessness where the animal stops responding or doing behaviors, good or bad behaviors, quote unquote, because they're afraid of the punishment. I see this a lot with patients that come in the hospital that have had punishment training histories that they don't even want to offer like a sit or a down unless it's cued, Whereas like my dogs have never had any sort of punishment history through the use of like positive punishment or negative reinforcement, then they are constantly offering good behaviors. Like, oh, mom, did you want me to sit? Did you want me to lie down? Did you want me to like lay on my side? And they go through their, rota of good behaviors in order to get a reward for it. Whereas these dogs that are literally just robots and they just sit there because they're terrified of making the wrong choice because they've been punished in the past for it. It's really sad.
Okay. One of Joyce's dogs was a street dog in the Middle East.
Okay.
He was initially a foster, but so terrified that she ended up adopting him.
Mm.
It just wasn't worth putting him through anything, more difficult.
Yeah.
He bonded with her other dog and won't go for a walk without him. And gosh, I wonder what'll happen.
Yeah, if that other
if
dog
for
is no
some
longer
reason
there.
the other dog can't be there.
Yeah, that's a really tough situation. And that not only, with rescue dogs, but that second dog you bring into the household, all they know is the house with that other dog. Dogs are going to grieve just like humans. Every dog does it in their own way. Some it's quick, and they move on really, really fast, realizing that they're not there. But others, it may take time and training and potentially even medication to get through that transition. Sometimes, not always, but sometimes getting another dog can help, but again, not always, because it's not that dog that they were bonded to. So that I take that with a grain of salt.
Yeah.
And
Kelly
if we can
rescued. Go ahead.
I was to say, if we can do just one more question.
Okay. Oh God.
So
Let me
pick a
figure
good
out
one.
what that would be. Well, yeah, a few more.
Okay.
I'm going to talk you into that. Kelly rescued a 2-year-old golden retriever three weeks ago who's afraid of a lot of things.
Oh.
She lives in a condo and must leash walk him. She's seen improvement and increased confidence. Her vet referred her to you
Oh, how
for
nice.
some behavioral training. But
Definitely
there's
make
still
your
a
appointment.
lot of information she's learning about him.
Yeah.
What's
we
the
can
best,
Yeah, I would say get in sooner rather than later because we can learn about your dog together. And so, things may crop up through the course of treatment that we can, add to our behavior modification plan and that kind of thing. But the sooner we get started, the better, because we're going to have the highest chance of intervention. So definitely get your appointment scheduled, and I look forward to seeing you.
And she said that Zesty Paws calming bite treats she feels they've been helping.
Okay, good.
Okay, wait a minute. I'm seeing if any of these are
Earth-shattering questions.
we're getting stuff like dogs that love Ella Fitzgerald and Louis Armstrong. And if you have a noise triggered dog and lots of power outages, she would recommend buying the speaker too. It lasts for 24 hours of playtime.
Oh, yeah, the iCalm speaker.
And can be recharged by USB in the car or outlet.
Yep.
Let's see if anything is actually great at night. Okay. My dog, our latest rescue, used to be totally fine sleeping in her crate at night. Recently, she's developed immense anxiety. She won't go in her crate. She licks her mouth and pants. Jeez. I had her licking pants, like you pull up to wear excessively. We then had her sleep outside the crate, but she's still anxious, pants, and won't settle for hours. We're starting crate training from scratch, but we're unsure exactly what she's anxious about. Possibly noise she hears outside that we can't hear.
Yeah. Yeah, it's very
We
possible.
play music for her as well.
Good.
And
Yeah, definitely the music and white or brown noise can help drown out ambient noise outside. This time of year around here, there's a lot of fox running up and down trying to find mates. And so that is a really common trigger for dogs currently. It's hard to say. I mean, there could be a noise that you don't hear even ongoing in your room, like maybe like the buzz of your phone charging that you don't hear, but that they can. So I would definitely also talk to your veterinarian about some anti-anxiety intervention in the meantime, because it sounds like not only is it about the crate, it's just about nighttime in general, and we need to really get this under control sooner rather than later.
And she wondered about pheromones for
Certainly
that
could
sort
help.
of.
Yep, certainly could help.
And the therapeutic dose of L-theanine for a 75-pound dog. Will it just say when you get it?
Yeah, well, unfortunately, I can't give that advice out to someone who's not a client or a patient.
All right. I know you want to go.
My family wants me to join them for a Saturday.
Okay. Let's see. Oh, I have a 2-year-old female Bernese that initially was afraid of everything, but now it is primarily people.
Aww.
We've taken many classes since I brought her home at 9 weeks of age, to include puppy shy, confidence building, and 2 obedience classes. Well, that's, but now she is more territorial and alert barks when people or dogs walk past the house. We did work with an animal behaviorist, I don't know what kind, a year ago, but overall, I don't think it was a good fit. I'm wondering if a reactive class or a different animal behaviorist would be useful. Any recommendations would be helpful.
Yeah, I would definitely look into a veterinary behaviorist, because as Deborah said, the term animal behaviorist gets thrown about willy-nilly. And I've even seen some shock collar trainers call themselves behaviorists, and they absolutely are not. And so I would get in either with your closest or ask your veterinarian about maybe even doing a vet-to-vet consult with a vet behaviorist. And then there are some people reactive classes, depending on where you are. Like I know here in our area, does YDF have a people reactivity class, Deb?
No, but I think, what's it called? Vivian Levin it's a training center in Virginia.
Yeah, Forget Me Not does.
One.
Yep, they have one for sure. So yeah, there's options there, but depending on the severity too, you really may need some sort of medication and product to help intervene.
Days after rescuing a 12-year-old chow mix, my neighbor's dog was aggressively barking at him through the fence. They met nose to nose, and it appears that they tried to bite each other. Now my rescue pup chatters his teeth anytime he sees another dog. I don't know if he's excited or scared or being aggressive. What type of a professional would I take him to regarding this issue? I'm scared to let him near other dogs now, since I don't understand his behavior.
Yeah, so I mean, I definitely would not let him around other dogs either until you have him evaluated. And a lot of trainers, qualified trainers, and you can find a list of good qualified trainers in our area on YDF's website. They will be able to tell you why the dog is doing this behavior, what the purpose is, whether training alone will work for your dog, or do you need to see a veterinary behaviorist for medication. So I would definitely reach out and find someone in your area that you can trust.
And here's another one of your patients thanking you, Lisa, and it's a Chihuahua pit mix. and I don't know.
I think I know
He's
exactly who
bitten
this
4
is.
people and 3 dogs. Does this sound familiar?
It does sound familiar. Yeah. And I think I saw Lynn and Lance was in the chat too. Lance is one of my special patients.
Yeah, they were there. Is she asking anything that we need to answer? Does this mean I'll need to? No. His reactive behavior has rubbed off on her other dog. Does this mean she'll need to repeat the treatment plan with the other dog?
Potentially. Unfortunately, they can absolutely learn behaviors. So.
Okay. The other thing I wanted to mention, which has skipped my mind. Muzzle training. Yeah. There is a really good vet, Dr. Chirag Patel has a video on muzzle training, and we have something which I wish I could think of right now, but
Chirag is amazing. He's a great trainer.
Under resources, what is it called? The Muzzle Project?
Muzzle Up Project. Muzzle Up Project. Project. Yep, okay. They have a Facebook group and a website. It's run by Michael Shikashio, who is a fabulous dog aggression trainer as well. And we have a muzzle conditioning class as well. So if you're interested in becoming a patient of ours, we would be happy to have you in our class as well.
Do they have to be a patient?
They do. Yep.
Darn.
I know.
Okay. Okay. Well, I'm almost actually. Oh boy. Okay. So here's oh boy. Okay. It looks like there are only 2 more, and this one looks not good.
Oh no. Needs okay. Dr. Pike. Good. No good.
My 3.5 years of working with a behavior vet, meds, and behavior mod has been going well. But a week ago, they had a very close call with an off-leash dog almost getting into a fight with her dog, who's afraid of dogs he doesn't know. It's now 7 days later, and every morning he's shaking for, wait a minute. I just lost he's shaking for longer and longer. Yeah,
that definitely sounds like a trauma.
Let's see. It's now 30 minutes, and he decided that I was his safety object. The behavior department, wait a second, this is off for the weekend. Besides holding him, petting him, verbally reassuring him, using pheromones, how else can I help him feel safe? We're avoiding leaving the apartment because it happened in a hallway.
Oh, yeah.
After 30 minutes of holding it, then takes another hour before he will eat, and he will only eat if hand-fed right now.
Oh,
how does she lessen that, to make it through the weekend?
Yeah, I mean, if you've been provided like an event-based medication, maybe for like veterinary visits, or some other sort of special event, like people coming over, you could potentially give that around the clock. I, of course, can't tell you which medications to use because you're not a client of ours, but try and do the best you can and get through the weekend. If you need to, avoid departures from the apartment, maybe we can, get into a car and drive somewhere real quiet to do some decompression walks, that kind of thing. But yeah, that's a tough situation. I'm sorry your poor dog was so traumatized by that.
And Krista has a rescue that was abandoned and moved around a lot.
Yeah, they just started a daily anxiety med, have met with a behavioral trainer. Any tips working on his separation anxiety when we have to leave the house? He will eat his bed and stuff. We do have a separation anxiety webinar
that's very good. And we
And I would,
also have a separation anxiety handout under behavior issues.
yeah. And it's really
But
important that you actually, when you're working through behavior modification, that they don't experience the trigger at the full force, so to speak. And so if you can't leave the house without your dog panicking, you are going to need to either get a dog babysitter if they're applicable to go to daycare. You can drop them off at doggy daycare, or time your errands with with your partner, roommates, where someone is always home with them.
okay, I think we're going to let you go.
All right. My family
And I
appreciates it.
thank
Wonderful.
you, Dr. Pike,
Oh,
and
you're
thank
welcome.
everyone for coming.
Thanks,
And
your
we'll
dog's
leave
friend,
chatting.
for hosting us.
Okay,
Bye.
bye.